Okay, so there's a way we could actually be monitoring the baby when it is still in the mother's womb. So one of the things we always monitor that is very vital is the fetal heart rate. So we are monitoring the baby's heart rate. We are monitoring the baby's heart rate. Now, one of the instruments which you can use to monitor the heart rate of a baby is the electrocardiotocography. Okay, so this is how this could look like. So they can also call it the cardiotocometer. Okay, now let's just talk about the various ways in which you can do this. Now you can see how they actually connected it. Okay, just to sense the fetal heart. Of course, you want to make sure that the baby's heart is beating very nice. Okay, so continuous fetal heart rate monitoring using fetal electrotocography. Electrocardiotocography is a sophisticated method, so you want to access that the baby is doing fine. Okay, so you combine electronic fetal monitoring with electrocardiographic analysis. So as you are monitoring it, you have the accelerations, decelerations, that's all those waves being displayed on a graph sheet. So you are trying to provide a detailed picture of the baby's heart activity, okay, and also how the the mother's uterus is contracting. So electrocardiotocography combines cardiotocography, which is this, okay, and the electrocardiotocography. That one uses electrodes. You understand? Here, in normal cardiotocography, like they put it right inside, but when you have the electro one, now you are introducing electrodes, where you can put it outside the mother's abdomen. You get the difference. So use electrodes often placed on the fetal scalp during labor to record the electrical activity of the baby's heart. You understand? So it's kind of like an external method. So how it works: electrodes are placed on the mother's abdomen, or it could be directly on the fetus scalp during labor. So the system records the baby's heart, how the uterus is contracting. Also it helps you to dictate if the baby is having sufficient oxygen or not. Okay, so data is usually placed on these traces. Okay, you can see different things. Okay, so to help you, so clinical benefits is it will help you dictate if the baby is stressed. Alright, there's improved accuracy, real-time decision making for whether you should go in for a cesarean section or you should keep going in for the vaginal delivery. So consideration may limit maternal mobility during labor, can lead to increased cesarean rate due to over interpretation of normal variation. So you have to interpret rightly so that you can make the right decisions also.